This morning, the Department of Health was notified by the Centers for Disease Control that an adult male traveled from Japan to Maui from January 28th through February 3rd, and then traveled to Oahu from February 3rd to the 7th. He returned to Aichi Prefecture in Japan and developed more serious symptoms there and sought medical care for those symptoms, and was tested when he was there for COVID-19 and found to be positive. During his time on Maui, he did not have any symptoms. He was healthy and well. During the time on Oahu, he did develop cold-like symptoms, some of the preliminary symptoms that you would expect to see with COVID-19, but no fever, which is important. As soon as the Department of Health was notified this morning, we began to gather information and work on tracking any close contacts. That's the normal procedures for this situation, and it's those individuals who we're most concerned about. As far as we know, the disease is not transmissible unless you become symptomatic, and then you're worried mostly about people who are in close contact with the individual for prolonged periods of time. Fortunately, the individual did not have any symptoms while he was traveling on Maui, and again, he developed cold-like symptoms with no fever when he was here on Oahu. The Department of Health is sending out a medical advisory to all the healthcare providers in the state to be on alert for possible cases. They've been previously notified about the disease, and they're ready and willing and able to attend to anyone who does show signs or symptoms of the disease. And we're also consulting with federal and county partners on the most effective measures to protect our residents and our visitors. We actually have a representative from the Centers for Disease Control with us today that was assigned to help us deal with situations just like this, who is serving as a liaison for us and the federal agencies. Because you're going to probably ask this question, I wanted to share with you that when he was on Oahu, he did stay at the Waikiki Hilton Grand Vacation, which is a timeshare in Waikiki. They have been notified about the issue, and they're helping us and cooperating with us and trying to identify any possible close contacts while he was here. We're still gathering information. Obviously, we're learning a lot more about his travel history when he's here, and we'll be able to identify additional situations where there may be a risk of transmitting the disease as we find out more. But we're of course focused on this, and we'll continue to investigate this issue until we are sure that there hasn't been any undue exposure to Hawaii residents.
So as already been outlined, a lot of what we're doing is notifying partners, the medical advisory for our healthcare partners, to make sure that they're alert and aware of the situation, and let us know if they have a patient who, for whom they have no other diagnosis and potentially could be presenting with this disease. However, what should be reassuring is the person was asymptomatic while on Maui and had only respiratory symptoms, cold-like symptoms, and no fever while on Oahu. That's somewhat reassuring to us, because we know that when you have the fever, you're probably more likely to be more infectious. However, as a precaution, we are working with the partners to identify potential close contacts, because we know the risk is for those who have that prolonged face-to-face close contact. And so we are consulting with our Japan colleagues. So the Japanese consulate is helping us to track down information as to the exact itinerary of this person. We're also working with CDC colleagues to also try and gather that information, because our focus at this point is to try and understand who potentially this person may have had close, prolonged contact. If you've had fleeting sort of in passing, you passed in the hallway, that is not our focus. Our focus is who this person might have sat down with, had conversation with. Those are the kind of things that we're looking for. Once we identify those persons, then we would make sure those persons would be aware and home monitored, or if the situation requires quarantine. If they do fall ill, that they are appropriately evaluated, and if they fulfill the criteria for testing for this virus, we would do that. So that's what we're doing right now. And I just want to reiterate, the messages that we've been putting out before are especially important now. This hopefully is a reminder and a note for everyone. This is why we practice the infection prevention measures we've been talking about. Washing your hands. Washing hands is important because we touch our face often. We want to make sure if we touch our face, which we should try to avoid doing, that it's with washed hands, not an unwashed hand. And also, if you do become ill, stay home. Do not get on the bus. Do not go to school. Do not go to work. Don't go to a concert. Please stay home if you're sick until you recover. And everyone, please take care of yourself, because having good health to begin with when you have infection it goes a long way in recovery, making an eventual recovery.
As far as we know, he didn't seek medical care when he was here. He did, however, go to a hospital in Japan when he returned, and he did develop significantly serious symptoms when he was there. I won't go into detail on that, but that's how they identified the individuals having been infected.
So the assumption is, because he became symptomatic during his travel here on February 3rd, that he most likely was infected while in Japan or potentially in transit here, and then was diagnosed when he returned to Japan.
So the incubation period is somewhere between 2 and 14 days. Some think it may be even longer than that. So the individual developed symptoms on or about February 3rd, and based on what we know about the incubation period for the disease, it's very likely the individual was exposed in Japan or in transit coming to Hawaii and became sick when he was here. This is how most cases in the United States are being identified. After someone's been exposed, and when they get home, they develop the symptoms. He was traveling with his wife, and obviously that would be a contact that we'd be concerned about. As far as we know, his wife is still with him in Japan, is no longer here.
We have very limited information. All we know are what we've actually provided to you. We know he was in Maui at the start. He was asymptomatic, and our focus really is on his whereabouts while he was on Oahu, because that's when he developed symptoms.
So part of the protocol is to work with the government in Japan and find out what his specific itinerary was while in the islands, and evaluate and identify any potential contacts, and then the department would follow up with those people. So you know exactly what we know at this point in time. We're committed to keeping you informed of what we know. As we get more information about his specific itinerary or places that he visited, then we will examine that and identify any of those workers that might have been exposed that we might want to contact and make sure that they follow proper hygiene and can stay connected with their medical providers.
If we find a close contact, obviously his wife would be a close contact, but others who were in close contact for prolonged periods, we would implement the same process that we typically do, which is to restrict that individual and isolate them in their home or in their lodging, wherever they may be, for a period of 14 days, so that they are not at risk of transmitting the disease to somebody else. Again, that would be only for the close contacts. For people who were casually exposed, say happen to be walking in the same room or walking nearby, we would not consider them to be at increased risk.
The investigation is ongoing, and so you can imagine that there are details that we still do not have, and this is why it's important we're asking you for help in letting our community know, practice the infection prevention measures, because by the time we identify potential risk, several days, frankly, may have gone by. So it is important for people to monitor their health, to be aware of washing their hands and avoid touching their face with unwashed hands, and to stay home while they're sick. So we're asking for the community's help, for all of you to be aware, and so that when we do identify potential at-risk individuals, they'll have already been practicing those things to minimize potential risk to others. The role of asymptomatic transmission has still not been entirely clarified, that it is felt that it does not play as primary role as being symptomatic. So the focus, as I understand it, and I'm sure my other colleagues in other jurisdictions understand it, we're focusing on symptomatic individuals.
I was in Washington, D.C., and we did get a briefing by the CDC and Department of Health and Human Services. You know, they made it very clear that this is a new virus and there is much more that we don't know they're making assumptions because it is a coronavirus that it behaves like other similar viruses. So even the incubation period is based on more what other viruses have been rather than specific information. So, we are taking what we know and applying it in the best way that we can.
We do know that every case that occurred in the United States had exposure to China or to other symptomatic individuals, a husband, wife, or whatever the case may be. So from the evidence we do have, the only people that are transmitting disease are people who are symptomatic.
That they are monitoring what is going on internationally and notifying us and other jurisdictions about that. But there is growing concern about potential for community transmission occurring in other jurisdictions. Remember that the World Health Organization has announced to all countries to consider the fact and be prepared for the fact that this virus may now expand beyond the borders of China. So that is a potential concern. It just goes back to, again, the importance of the infection prevention measures. Wash your hands, do not touch your face with unwashed hands, stay home when you're sick, cover your cough and your sneeze. I can't emphasize enough how important that is right now. So what's happening in Japan is a concern that I have to defer to our federal colleagues. My focus is on what is going on in this state. Of course, I'm very concerned about our residents outside our borders, but our focus is here, and we depend on our federal colleagues, the Centers for Disease Control and Prevention, to ensure that not just Hawaii residents, but all U.S. citizens are appropriately cared for.
We've talked about the scenario of passengers from that cruise ship coming back to Hawaii and how we'd handle those. And again, here we would resolve uncertainties in favor of protecting public health. We would be looking at a continued quarantine period for those individuals of 14 days when they arrived here, just to be sure that they weren't transmitting disease. This is home quarantine or quarantine in their lodging, but we felt that was prudent, not knowing when they might have been infected on that vessel. It could be just before they left. So it's not every case is going to be handled on a case-by-case basis, but as it is, we would be looking for an additional quarantine period for those who are asymptomatic but may have been exposed on the vessel.
So, every organization has its own protocol, and as soon as the health department was aware of it, they informed the hotel or the timeshare. And I actually reached out to them and talked to them too. They're taking direction from the health department, but they're in the process, and you probably need to reach out to them to see exactly what they're doing. Every organization has it a little differently, but they're really focused on protecting their visitors and their associates. So I would reach out to them for the details. I would say that the experience I have and the interactions I've had with the hotel industry and the management teams is they're as focused on all their associates and the visitors. So the expectation is they're going to keep them well informed and follow the direction from the health department on what's the best way to protect them. That's the feedback I've got.
The only class of workers that we feel are at increased risk from this virus are the healthcare workers. All the others, we'd recommend take their normal precautions. Maintenance workers who have safety devices, gloves, and so forth should continue to wear those. But there are no special requirements for individuals with that may be exposed to this virus. It's not thought to impact any particular occupation, including, by the way, airlines, flight attendants, and others. In any special way, but healthcare workers are being advised to be careful and wear their protective equipment when they are working with patients.
So at this time, we are still pending the flight information, and again, we are working with CDC colleagues and the Japanese consulate on that, securing that information. We do know he was wearing a mask, so that is helpful. Masks, surgical masks, by the way, are helpful when you are sick to further prevent you from infecting others. So we have been advised that he was, while traveling, wearing a mask. So that is good news to hear, because it does minimize risk to other travelers. But we are pending that information at this time, and we would be working with our CDC colleagues to potentially identify at-risk travelers. The way it works, they're As you might imagine, there have been a number of individuals who've traveled by now, especially from China. And what happens is CDC, Global Migration and Quarantine, gets the information, notifies the jurisdictions when there are travelers that potentially are at risk. It's our job to get in touch with the traveler to let them know potentially that what their risk was, and then to put them into home monitoring, our home monitoring program. So as Dr. Anderson has already described, so that is how the process works right now. There is a heavy flu season ongoing, especially on the mainland. It is why our medical advisory reminds our healthcare providers, don't forget that common things are common, and that we do need to make sure that before we sound off all the alarms, we need to make sure the regular flu test is done, if not the entire, looking for other more likely etiologies. Because that is still going to be more common, more likely than this novel coronavirus. The information we have at this point from our CDC colleagues is that they're busy right now reformulating a portion of that kit that was flawed, and their plans are to send that new kit out to all public health labs in the next week. That's the information that we have at this time.
I certainly had the opportunity to talk with the CDC and explain why, from being in Hawaii because of our isolation, the other states were surprised to learn that for us, because we have to ship it back to Georgia and back, that it would take a week or more to get results, and they recognize that Hawaii is a different situation, and they are definitely focused on getting us valid test kits as soon as possible. They recognize that the state having the capability to test in-state greatly accelerates our ability to identify the virus and then take appropriate action. So I had the opportunity to speak with Senator Schatz and Senator Hirono, and we exchanged information. They obviously were briefed by the federal counterparts as well. So we all made it very clear about the situation in Hawaii. He is pursuing additional resources from the federal government side to make sure that the response team at the CDC and all the way through down to the food chain has the resources they need to appropriately respond to the situation. Obviously, the state and the local partners are acting within the budgets. Obviously, it's a priority to make sure that we're well resourced. I don't believe that resource is an issue at this point in time anywhere to the state. We understand that this situation can become very a big concern, and so we want to make sure that the resource is not an issue in the response at this time.
We believe we have the resources necessary to deal with this situation. If things change dramatically and we start seeing hundreds of cases, that may change. But the Division of Outbreak Disease Control is well staffed with expert epidemiologists, and I believe we are in a good position to chase down contacts and so forth. Our laboratory is one of the best in the Pacific area, so they are able to run the PCR test that we will be receiving, and there isn't any additional cost associated with that at this point in time. So as it is, I think we're in a good position to respond, and if we do need additional funds, those are also available. We obviously wanted you to hear about this and get the facts straight right from the get-go. So we'll try to keep you up to date on what we're finding and our actions as we go forward.